So this panel is basically we're going to talking about from the prediction to impact and serve as moderate agency. So I'd like to get a chance to kind of summarize what we have just gone through this presentations for including myself, looking at our experience about the risk predictions. Now, I'd like to pass in this questions to like the Tom, since this is probably natural, you are kind of connecting from the previous presentations. So what could transform like patients and population's outcomes when there's some errors you might able to incur in your kind of work? How are you going to deal with those kind of situations? Sometimes measurement error, sometimes is a data error qualities. Can you talk about kind of governance and then issues you might run into this kind of observation data, which is typically have some data issues?
Yeah, sure, Lejang. Thanks for the question. And I'll say, regardless of data model, and we talked about PCORNet or OMOP or other types of data models, they are all going to be inherently screened and evaluated for quality and fitness for use as part of any research program. So I was talking about N3C, and I was talking about both the PCORNet sites and the databases that they operate off of. Before they get deemed research ready, and it is a term that we use within PCORNet, like literally research ready data marts have to be approved. There are hundreds of data quality checks that you go through, anything from basic plausibility of like conformance to the database to plausibility. For some, do you have pregnant men, were people born in 1850, all the way through much more complicated clinical concepts like what's the average number of encounters or the average number of diagnoses within a database. So you can think of quality as a broad component that oversits over all of the database work. That's one. Is it good enough? No. We've seen in various research studies that it's not good enough. So oftentimes what will happen, so I was showing you the recover data, and other folks are showing data. The research projects themselves are going to have the same type of regime. The questions and the concepts of data quality are different. And so despite how good your broad data model is going to be, your research studies are going to find holes. And then so the challenge for the team, and it really is a communications challenge, is how do you inform, well, how do you first off mitigate the research data quality problems? And it's usually back to source and finding issues in transformations or transfers. But then from there, those can be fixed for the research study. And then what's the feedback loop to make sure that they're fixed across the wider database, so that every study is leaving some kind of an artifact of improving data quality. So that's part of the regime. It's probably maybe a little bit different than talking about missing data or imputations or other things, but that basically underscores the quality regimes that happen in these types of networks, Lejang.
Okay. What do you have anything? Okay, so given that we have a great mix about the panelists here, professors, the researchers, and then newer researchers, seasoned researchers, and then a doctoral students. So what do you think your definition about AI researchers is going to look like now and maybe in 5 years? So Dr. Should you might start with since you're probably the most seasoned AI researcher. So what do you think about AI researchers look like?
I would think at least two category. More is like a more kind of focused on develop AI technology, evaluate implementation of AI, kind of more focused on some aspects of AI research, and which is already broad. But then I was thinking, even for students, it's need to be more like a AI ready, because it used to be, okay, you do wet lab, you probably don't need to have a lot of hands-on, like a processing data, analyzing the data. But now those days with the AI tool, it's actually become very easy for even wet lab student researchers to learn about using AI tools to do data analysis and all those things. I would divide those two, like more, one is really like a AI focused research, but the other is even any kind of researchers need to have some kind of AI training, AI knowledge, so they can actually become, in the developer world, we can full stack developers, but in the research world, I was thinking like a full stack researchers who also have both experiment skills as well as the data analysis using the skills using the tool through AI, make it easier.
Yeah, I think like from an engineering student's perspective, I feel AI could be very useful in relieving some computation heavy burdens during research. Like they are very useful for detecting bugs in your codes or guiding you through collecting data, processing data, and organizing them. But in the meantime, we can keep the research logics on our own. Like it's the people researchers who decide what data could be contributional to this topic and how we're gonna design methods that can make the best use of the data and output the desired predictions or results. So yeah, I think it's a good chance to rely on the AI to improve efficiency, but in the meantime, to have our own ideas and tastes for research is essential for PhD students. Yeah.
Thank you. Yeah, that's kind of from a PhD student perspective, definitely very interesting. Tom or Ilu?
Okay. So I think as a new researcher or early career researcher, I just transform from a student to a new researcher. So I use AI when I was a student, and I use AI when I'm a new researcher. So AI for me is like a tool which kind of make my work more efficiency. I reply email using AI. I make like literature summary by AI, and I check the codes, the correction codes with the AI. So I think AI kind of accelerate our research process, and everyone can be a AI researcher, even a student without any say like the device or without the high skill of the programming, because currently we have very fancy tools, for example, like the Google Colab. You can use the generative AI to help you build up the codes, and it's all in a browser, in a cloud. You don't have to have the high CPU or some other like high speed tools to use for the running. So I think everyone can be the AI researcher. Yeah.
Tom?
Lisheng, there's a lot of ways you can answer that question. I think what first popped into my mind, and it was during your presentation and related to Aaron's question around the image interrogation of images, and just because there's such an opportunity there, and we were talking about built environment, social environment, and then you'd think then, all right, other visualization use cases related to AI that are way more clinical, that are looking at lung scans or liver scans. So you can really think of the whole manifestation of health, from clinical health to social health to behavioral health. And images, oftentimes, Lisheng, you yourself mentioned taking images of food that you're eating. So that's a behavioral use case. And then you're talking about a social environmental use case. And then you look at lung and liver scans, which are way more clinical use cases. And so just the power of images and the power of AI to decode images and to bring those images into structured data that can then have more traditional machine learning AI models hit, I think is a really interesting opportunity across the whole continuum of health.
Okay, I'd like to change the gear a little bit. I think since we're kind of talking about AI, obviously, there's a lot of buzzword about AI, but I think, everyone can start some AI-related kind of work. So if it's a first step, we want to get into the AI, usually we are running a very tight budget. And then, so this question is, if funding is tight, what is the smartest version you will keep that still deliver value, and what would you drop? I really kind of open this to Well, if you can think about if you have a tight budget, given that this year's kind of situations.
We always have a tight budget.
Yeah.
I think just for example, just on the resources tight, right? Because a lot of people ask like, okay, we don't have GPUs, can we do AI research? And I think there's actually multiple answers for this kind of thing. You can think about collaboration with your collaborator. Maybe, for example, I collaborate with University of Florida. They have big GPU cluster. That's where I trained my Milama model. But then there's also industry collaborator, right? Google, and also they also provide some kind of resources. And sometimes they also have those pilot projects like Meta. I remember last couple months they have a call for application. You can ask for 96 GPU running for a month, like a kind of resource grant. And then government, I think, also start to provide kind of more infrastructure for GPUs. So you can also, I remember NSF has a couple of like GPU cluster. Everyone can actually apply for this kind of resource. So just use that GPU as an example. I just thought we just have to be open-minded and trying to figure out what the available resources we can leverage to do this kind of research. Yeah.
Okay. Anything to add? Okay. Well, to me,
I'll add one thing.
Yeah, one. Good.
With that 100% and those collaborations to research units like UF that have those big GPUs is a really savvy way of doing it. The other thing is that we're starting to experiment with, and we're at the early stages. Others are probably much more sophisticated. In fact, I know that they are because we're working with some folks at the University of Missouri that are really mentoring us on this. Is just the whole concept of data centers and on-prem or migration to cloud and AWS and Snowflake. I mean, there are some really amazing innovations in terms of data processing that are happening. And so what we're doing is it's a dip in the water, but we're running. I talked to you. I mentioned very briefly the data quality queries. Those things are those queries take days, especially on a data mart like Sutter Health, which has like 6 million patients in it, right? So to run a data quality package on Sutter Health will take you 8 days. And so analysts have to plan for that because you've got a cycle, you got to run it, and then it's not going to be right. So you're going to have to mitigate and you're going to have to fix. And if it's another 8 days, then the only way to really meet a deadline is to really work early and plan hard. So what we're trying to figure out is like these are all standard on-prem data centers. And so what happens if we work with in an AWS cloud environment with Snowflake, and how can we reduce that amount of time from 8 days to 5 days? And it might sound a bit trivial, but when you're on a 60-day cycle, and your chunks are 8 days versus 5 days, you get a lot more chunks if you've got 5 days. So that's the first thought that I came to, Lejang, is just the evolution of compute. And I mean, I'm talking about it in a kind of a non-AI, very traditional sort of SaaS package way. But the same thing applies for AI work.
I also think for those online large language model, they also have some kind of like academia program, right? Like Google also provides some kind of free use of Gemini if you're a student or trainee or something like that. Yeah, you can explore those opportunities as well.
Okay.
Doctor, sorry.
Okay, good.
I also want to mention that even with very tight budget, I think for a success model or a prediction, it's very important to have the engagement from the end user, because that build the trust, build kind of how they can really apply to the real life. Yeah.
Yeah, I think adding this one is that I think Mel mentioned that the domain knowledge is critical. So in other words, we really need a multidisciplinary collaborations. Those knowledge, for example, if you are having a good clinical experts in your team, that's a lot of cases. It's not just we're competing on the computing power. A lot of cases, you're using the most powerful thing is your brain, right? Get the smartest doctors, medical school, or some content experts to help you to building those risk prediction. Probably is going to be better addressing your shortage of the computing power. I think that's going to be a critical thing. So I think we're very much is a risk prediction sessions, and I like kind of tie back into risk prediction. So, Ilu, I think I have a question for you. For example, like you have done the risk predictions for the kidney disease, then your tool flagged those high risk, low risk, intermediate risk. Then what happened next? If you got this kind of things, any thoughts how you can take this kind of tool into a future application and then really make sure that your product, your knowledge will be really helping patients with the chronic kidney disease?
Yeah, so ideally, if it could be implemented in a hospital in the Epic EHR system, then the EHR system will create an alert for the physician to notify that, hey, this patient is in high risk. And then if the patient has some like wearable device, then it triggers the remote monitoring for these patients. And then they may also create some like suggestion for the targeted intervention for these particular patients. And all after that, I think it's kind of turning these red flags into kind of action. And if the patients have several red flags, several parameters, several biomarkers, they need to take care of their blood pressure for their CV risk, they need to take care of the lipids file, they need to take care of the weights, then we need to identify which is the most cost-effectiveness parameter to identify to help these patients to lower the maximum risk for him or her. Yeah, that's what I want to do in the future.
Can I add a comment?
Yeah.
Actually, I think Epic is going to do it. So I think 2 weeks ago, there's an Epic meeting. A lot of physicians, I heard there's 12,000 physicians in the room. They announced the Epic large language model, the COMET. They trained on the Cosmos data. They showed the dashboard to predict how likely the patient have gone to have this disease. So I think they are planning on that way.
Yeah.
That's a good sign. I mean, it's going to help. Yeah.
Yeah, if so, then we may also take advantage of the AI to kind of use the explainable AI to the physicians and also generate some like education materials using the plain language to the patients and also their families. Hey, you need to take care of this, and so you will have such benefits. So something further step like that.
Yeah, I agree with both of those comments. I think another thing that I'll offer, Lejang, is that health information exchanges are starting to use that risk prediction to connect to non-clinical care coordination, such as care navigators or community health workers.
Yeah.
And then those community health workers can connect high-risk patients to social services if necessary, or just help them manage prescription refills and so forth. So there's been a lot of work and a lot of literature recently on the value of community health workers to reduce the overall burden of care and cost of care. And then there are models, whether it's NowPow or Pulsar or others, that'll actually electronically connect the data. So health information exchanges will send risk scores to community health workers. Community health workers will follow up with social services and close that non-clinical loop. So it's a really strong non-clinical social service sort of community-driven use case to risk modeling as well.
Yeah, so I like to take this as a kind of from a health policy researcher perspective. So I think this is wonderful, but I think there's obviously a opportunity. Maybe it's some misalignment there. So the savings, right? You have better manage our patients. The savings belongs to the insurers, belongs to health system. The community health workers really not getting the benefits. So even though they have a wonderful technology, but in the actual implementations and make this kind of multi-sector interventions, you have to make some realignment of incentive, make sure that the community health workers and then those community health organizations really can gain some benefits with better managed the chronic conditions. I think that's very important because we have to have this kind of technology for a long time, but actually why it wasn't really having wide uses because there's a lot of misaligned the incentive there. So I think that's very important. So I want to change a little bit on this one is fairness, right? So when we're talking about the AI, we're talking about health information exchange, we're talking about all those health informatics. So, if the tools you developed, then how we can address, or at least in mind, I think this is a question for everyone. I would like to start from Mel, basically, any kind of fairness considerations. I know that, your work is a social determinant house. So how, potentially, in addition to improving, we keep talking efficiency now, how the fairness, equitable issues be addressed in this kind of AI research?
Yeah, I think in healthcare settings, fairness can refer to predictive models output are unequal or not leading to the same benefits for demographic groups or the groups defined by social determinants of health. I would say to validate a model bias or fairness is essential. Like you need to define the groups that you want to check performance disparity across, either by ethnicity, race, age, those demographic attributes, or like insurance type, patient's address, social economic status. Yeah, and as we all know, like model learn from the data, and data collection process has inherent bias, and the model can pick up the biases from data and even the model designing algorithms. I think too, there are fairness mitigation algorithms in machine learning that people have been applying. Like they can crowd into definitions tailored to each application. The fairness in like legal applications must be different to healthcare applications. So based on like you want the model to have like, equal positive outcomes or equal accuracy, whether it's on a group level or individual level, yeah, you design your fairness metrics, then you can adjust your training data to maybe more representative for different demographic groups or for geographic areas. That's like from a data perspective to fix the model. And of course, during model training, can try to twin your algorithms to add more regulations, like not just getting accurate outputs, but to make sure the output is not disadvantaged for any specific groups. Yeah, so I believe there are like a lot of current fairness issues and in like real world applications, and it's essential to examine the issues on the very early stage, and also keep monitoring for the issues, because like model is not like you fix this once and you're all done. Model keeps learning from new data and might pick up new bias and fairness issues. So like be mindful of its performance during implementation. It's also important. Yeah.
Any panelists have anything adding about the fairness part? I think, Tom. Yeah.
I agree. I think that we talked a lot about the connections between clinicians and technologists, and have made that case that the pair is better. I think that what I would add to this conversation is patient engagement and transparency as well. It really works well in the research space, and I think that that's been shown over the past decade that having patients engaged in research that's about them both makes the research more personable, but also just better science. And so I don't know a lot about what's happening in technology and AI model generation and engaging of patients in that process. What we do know is that we've been engaging patients in the research process here. Zheng, you do it. Others in this room have done that and seen those benefits, both in terms of the science being better and the transparency building trust. So I don't know if those models exist or not. I mean, if folks know about it, I'd love to hear about it. But I think that engaging and integrating the patient voice in the algorithm development and in the monitoring that was just discussed would help tackle some of the issues related to acceptability and trust that others have rightfully pointed out throughout the day.
Yeah, I'd like to open, I think that's good timing. So You have questions? We can pass the mic to you. Yeah.
So in terms of AI models and how you predict this, like mostly the AI models are based on you're looking at the variable importance and which importance gives you which one. So how do you link that to a causal way of saying like, okay, this is the cause that leads to this disease, and so this is where I have to intervene because AI model tells me, I'm not 100% sure, but I'm just asking. If AI model tells me that this is the most variable importance in the negative direction for this particular health outcome. So should we intervene on that one? Is that the cause of the disease in epidemiological framework? Did I get my question?
Yeah, so basic causality in our or transparency in our causality in our risk predictions. I think that
because I think we spoke a lot about tertiary and secondary prevention, but the primary prevention, if I want to identify the risk factor, then going after an individual and predicting their risk. So how can AI models bring out that particular thing of, okay, this is I can say that there is a attributable thing for this particular variable or risk factor for this particular health.
Any thoughts on this?
I think I've read some work in the interpretable AI that for models processing images or natural languages, they can visualize the parts the model is paying high attention and therefore playing a crucial role in drawing the conclusion. I think to process unstructured data and to explain like the black box model, it's still an open question. It's very challenging. We can utilize the current explainable tools of AI and like even to let AI to produce the confidence level of its decision and to like for LLM models, it can justify its decision on like all basis or references of the prediction. And yeah, that could be a direction.
And we may also use the literature review and also some expertise consultation to see whether these parameters are really in reality that's linked to our outcomes. And we may also use some like AI tools for like the composition analysis to rank the importance of each parameter, the contribution to that final outcome to see whether there's really an association between the parameter and our outcome event.
Any question from audience? Yes. Okay. Yep. Do we pass the mic to him?
I have a multi-tiered question, and one of them is about endpoint security. So if you were using, let's say, cloud-based service like NVIDIA or any other data sharing, where you can offload your work off of your architecture and put it somewhere else, how do you account for the endpoint security? And was there any scenario where if you did not have access to a budget for that, and you had to use like your own whatever GPUs or like any if you didn't have that computational power, did you have to use a model that wasn't exactly designed for it but doesn't need that kind of computational power? And lastly, if you are using machine learning for as like you're expanding it to like wearables or other devices, in terms of like building a career in machine learning, would you encourage having that API knowledge for those devices, or is that a different person that handles?
Xu or Tom, you have the data.
I probably can answer for the first question on the security, because we recently are building some secure computing environment like the NIST 800-171 environment, because recently NIH requires like a control access data set like a dbGaP data. If you download data from dbGaP, you need your local NIST 800-171 environment at each university. So recently we actually at the Yale built this kind of two environment, just to the two categories you mentioned. One is a local kind of cluster, so it managed by Yale IT team. And so we hired a third company go through that certification auditing, like to make sure it meet all the NIST 800, 171. So it's not just about the hardware configuration. It's also a lot of is about auditing policy. All the people have to get training, all those. So that's the requirement for this kind of secure environment. And the second one is we actually also build a cloud-based one, basically on the AWS. And if you look at AWS, they provide the environment, secure environment can support almost any kind of standards. This 800, 171, or even FedMap or things like that. So you just have to follow. I think AWS provide all the qualification for the hardware stuff. But then again, you have to implement all those policy, monitoring, auditing step to make sure it complying with the requirement.
I can answer the first question related to the privacy and the data safety. It's not just about the AI, it's actually for all the data, we need to have this lock down this privacy. I will use the Veteran Affairs Electronic Health Records Health Systems as an example. In VA data, we submit an IRB, and then with approval, they help us to generate a data folder, and only the key personnel that you listed in the IRB could access this data folder. And in that data folder, VA Data Manager will help you cut your your sample data. And then you're not allowed to download those data, although you can send out the results for tables. I tried to download the physician notes. I just copy and paste it, actually not download it. And then VA shoot me an email, say, hey, it seems like you're about to download it. No. Then it's just for checking for the physician notes, and they're really sensitive for that. Yeah.
Yeah, I think the Tulane also provides some securities, and then Oscar and I have been working with the Tulane ITs, trying to make sure giving the highest standard possible in the Tulane environment for data storage and management. I like to probably it's going to be any more questions? Okay, yes.
I'm the IT director, and I work with actually a lot with AWS. Is there any specific skill set you wish that IT had that to better support your AI research? Any skill set that IT should be learning to help you with your support of AI?
Well, I use AWS and work with Oscar a lot. Actually, honestly, I have to say he knows much more than me. And I always come to him for help to set up the whole system, or even some R codes, how to link the AWS to our remote workspace. So I don't really know what exactly the skill set.
Sure. I can comment a few. I think a couple of aspects. One, if you maintain a local, like a AI GPU cluster, then it actually really need those kind of person know how to maintain those high performance GPU cluster, which is slightly different skill set. Used to be maintained HPC, like a CPU based. Even the cooling system might be different, so that kind of thing. And also, the other thing is now we are running this secure cluster. The whole thing about this, like a data security, like how to upload data, how to move the data, and all those things, actually, they have to be very clear and make sure compliant with all the policy. And in terms of using cloud resource, for example, we actually use the OpenAI, like a ChatGPT license. We at the Yale, I actually have access to like 3 different type of GPU API. One is through my lab, direct license from Yale, direct license from OpenAI. which I can send the public like a biomedical literature data to them to do processing and all those. Second one is Yale University licensed from Azure have an OpenAI ChatGPT instance. Then you can send the university data to them but then when first announced, they say you can send any kind of data to that. Then physicians say, can we send the patient data? But it turns out we cannot. And then we have the third one, which is on the hospital side, which is a license between hospital and Azure, also have the ChatGPT. That one you can actually send those patient information because there's BAA between the hospital and the Azure platform. So all those kinds of initially just not very clear to everyone what you can use for what type of data. I think from that perspective, if the IT department can really give a clear guideline about what type of data for what kind of platform, that would be helpful.
Yeah,
it took us a while to really figure this out.
Yeah, Tulane is using Azure, so this kind of for FYI, so that they're in the cloud storage. I think that's what they preferred platform. I think we kind of almost at the top of the hour, so like to conclude this panelist, but like to still harness your wisdoms. So this is a standard question. In 10 words or less, what are your key takeaways from today's discussions and panel? So starting from
I think. Positive with cautious.
Okay, good. Okay. Tom.
I would say human or social plus technological interactions.
I think it's data talks, AI assists, humans lead.
Okay. Okay. That's good. Nice.
Very nice. I agree. Yeah, I guess to embrace AI as how AI has been frequently mentioned in today's symposium, but be aware of the risks and outcomes. Yeah.
More than 10 words, but I think that's still good. Okay, thank you for panelists. Let's get around hard. Okay, thank you.